Hey everyone, welcome to Your Health Partner, brought to you by Lehigh Valley Hospital Hazleton, bringing you constant information what's happening in healthcare. As I keep telling you, my friends, Lehigh Valley Hospital just continues to raise the bar. Now, ExpressCARE. What do we know about ExpressCARE versus emergency rooms and family medicine at ExpressCARE? Today we're going to find out as much as we can to tell you how to use them. I'm very happy to have on the show Mark Prezioso, who is the Associate Chief Medical Executive and Assistant Medical Director for ExpressCARE, and Victoria Howard, who is the Program Administrator for ExpressCARE. Hey, thanks for coming on the show.
Thanks for having us.
There's a lot of great information that we'd like to know about ExpressCARE. We see them, and no difference. But first of all, we always like to know who is in charge, a little bit about themselves. So I'll go with ladies first. Victoria, tell me about yourself.
My name's Victoria Howard. I am the Program Administrator for ExpressCARE. I've been with ExpressCARE just shy of 7 years and very excited to welcome our new ExpressCARE location in Hazleton.
What do you do?
I am the Program Administrator, so I oversee the operations of the division of ExpressCARE. So right now we have 20 locations that I have operational oversight of.
Now, are you responsible for every location?
That's correct.
Okay, and your duties and responsibilities?
So operational oversight, I do a lot with strategy and finance, and I work directly with Mark to look at ways that we can enhance our what we deliver to our community.
So tell me about your role and what you do.
Sure. So again, I'm Mark Prezioso. I'm the Associate Chief Medical Executive. And my job with the division of ExpressCARE is I oversee the clinical operations. So direct oversight of all of our clinicians, physicians, physician assistants, and nurse practitioners. And then I work with Tori on strategy and development, how we can kind of grow our services.
Let's talk about that strategy thing. I mean, like, when you say strategy, what do you mean?
I think for some of us, it's a way for us to increase access to care for patients, keeping people out of the emergency room. Having an ExpressCARE in this area, we're able to keep people out of the ER for where they would have gone for, minor illnesses and injuries. Also, part of our strategy is to partner with our primary care colleagues. If their schedules are filled, we can be that outlet for patients to come in and see us for acute care needs because their doctor's offices are filled. Okay, so you brought a good point up here. It's like when something happens,
if you're not feeling good or whatever, do I call my primary doctor? Do I go to the emergency room? Do I go to ExpressCARE? So I'm confused right now. So give me some direction as to what should I do? What is the difference between the emergency room and ExpressCARE? So I'm not confused.
So it's a great question. So from an ExpressCARE standpoint, they're walk-in care services for acute care needs. You have sore throat, headache, flu-like symptoms, an earache, you sprain your ankle at a sporting activity, you're out for a run, we can see all of those things. Even, for instance, if someone's cooking and they cut themselves with a knife, come in and see us, we can close that wound up and get you on your way. On the opposite side of things, it's important to note for like emergency room, if you're having, severe chest pain, okay, or you're short of breath, those are reasons you want to seek care in the ER because there's a higher level of service and imaging modalities that we have there that we don't have in these urgent care centers. Another example would be for head injuries. Someone has a head injury and they're complaining of a headache, dizziness, it would be important to see them in the emergency room.
In terms of services, you mentioned minor things, okay? What if someone comes in and it's not a minor thing? They think it's a minor thing.
Sure.
Like, my pains in my stomach. Let me go to ExpressCARE, but it could be something. I mean, how do you know the difference here? What do you do?
So you can come and see us in ExpressCARE for absolutely anything, and it's our job. We can clinically decide where you need to be, follow up with your primary care doctor, or actually, in fact, you need to be in the emergency room at that moment. So our clinicians are trained with backgrounds in emergency medicine and critical care. So if you come in and you have lower abdominal pain and I'm worried it's your appendix, I'll explain to you, it's great that you're here, but we need to get you over into the emergency room at that time. So to your point, if something is more critical, we'll stabilize you, we'll give you what we need within the ExpressCARE, and then we'll get you to where you need to be, which is typically the ER. If it's something that's more minor, cough, cold, sore throat, ankle sprain, come and see us through the urgent care or express care services. If something is more serious, where you have a head injury, you're having this stomach discomfort that's unexplainable, things that are more severe, then you want to end up in the emergency room. But again, it's important to note that if you end up in your primary care doctor's office or our express care locations and we feel that you need that higher level of care, we'll get you to where you need to be.
See, that's the concern. Sometimes when there's an emergency happens, okay, or you're not feeling good, you call your primary doctor and they're busy, if they're not available, you know, how long do I wait before I come up to express care? Now, do I need an appointment to come to the express care?
No appointment needed, though we do have an option for people to save their spot ahead of time using My LVHN or lvhn.org to reserve a time slot, but no appointment is required to visit any of our express care locations.
All right, so will I have a problem then if I go to express care and I couldn't get in touch with my primary doctor? Okay, do you contact a doctor if it's something that's, you know, of serious nature?
So we absolutely do. So if you come into the express care and you see me, I can get in touch with your primary care doctor and say, saw so-and-so, this is why they're here, and we're referring them back, you know, because they need X, Y, and Z taken care of. Or we also let them know when they end up in the emergency room. I think it's important that communication happens. So all of the primary care physicians within the organization are aware of the care plans from express care, so we can get a hold of them at any time.
Okay, so you said, you know, if I bring my child or myself to the express care, I could call and tell you I'm on my way up or whatever, and it's like getting an appointment?
Yeah, you can reserve a time slot that's convenient for you at our express care locations via My LVHN, the app, or lvhn.org. You can also just walk into express care. We're open 8 a.m. to 8 p.m. Monday through Sunday.
Okay, now here's the important question. I know I'm coming to express care, but who's going to take care of me? Are they qualified? Do they know what they're doing? You know, I mean, so we're open, but who's there to take care of that particular person?
So we have great staff, from our clinical staff to our providers, and then specifically the providers or clinicians that we have. There's an onboarding program that we have through our department to get people acclimated with the urgent care environment. And our clinicians are trained in primary care, emergency medicine, critical care. So when people come, they can rest assured they're in the right place.
So good. So now I know if it really has to be an emergency, that person's trained enough to say, hey, Mr. Lesante, you need to go to the emergency room. And then I may call the emergency room and say, Mr. Lesante's on his way, or we have blah, 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 blah. Am I correct in saying that?
Correct.
Okay. Do you find that, what are most of the people coming to the express care?
Depends on the time of year. Right now, we'll start seeing people with flu-like symptoms, fever, cough, sore throat, headache. But it can shift a little bit as we start getting more busy with sports. We see, you know, ankle sprains, wrist sprains, broken bones. So there's a seasonal component to it. But right now, you can expect to see people with those kind of upper respiratory flu-like symptoms start to come into our offices.
Okay. So tell me about flu shots and tell me about COVID shots.
So sure, we offer both flu shots and COVID vaccines at all of our express care locations. So similar, you can make an appointment or you can just walk right in and we can have that done for you.
So you're covering all these areas?
Yes.
Okay. If someone asks, you know, I know the difference between, I'm starting to get a really good education, the difference between emergency and express care. And I think that's important for the community to know that, you know. Primarily, I'm concerned about the health and welfare of either myself or my loved ones or whatever, okay? And that's where I think we have the faith in saying, well, go to express care. They're trained, they have this, same as the emergency room. And I guess the reason for, when you're talking about strategies, the difference between developing express cares versus emergency rooms, what was the strategy there?
Well, I think a lot of times that people that are in the emergency room don't need to be there. And so where do they go? And it's difficult because if their primary care offices are busy and filled, they're just going to ultimately end up in a different ER. So from a strategy standpoint, opening up these walk-in centers, express care, urgent care centers, that pulls that volume out of the ER so that the really sick patients can be seen by those physicians. So that's really important. So the strategy behind it is to pull some of that volume out at a lower cost and get people seen quickly and efficiently.
So that's interesting because express care, if it's emergency room, you'll say, look, you need the emergency room now. Do they do the same at the emergency room saying, look, you don't need us, you need express care? Do they do that?
No, so once they're seen there, they really need to stay
They
within
have
the
to
ER.
stay there.
Yes,
Okay.
correct.
Yeah. So you cannot say that this could be something for ExpressCARE. All right.
Correct.
So that's always, you know, an interesting thing.
question, sure.
Yeah, yeah. So, well, anyway, the ExpressCARE is located now at Hazelton Beltway,
Yep.
right? Open 8 a.m. to 8 p.m., 365 days.
That's correct.
And I wish you well. You know, it's I've been doing this show for many years, and every time I do this show, I learn something about how Lehigh Valley Health Network is really caring about, you know, when we say your health partner, they really are your health partner. I wish you the best, and thanks
Thank
for
you.
coming
Thank
on
you.
the show.
Thanks for having us.
Okay, we're learning a lot about ExpressCARE, my friends. We'll be back right after this. Well, welcome back to Your Health Partner, brought to you by Lehigh Valley Hospital Hazelton. Continuing to lift the bar up, learning a lot about what's happening in our healthcare industry. We have today, we talked about ExpressCARE. If you just tuned in, very important show to tell you the difference between ExpressCARE. And now we're going to talk about primary care. They're located in the same building. No stranger to the show, she was on before, Roslon Johnson and Kristin Cortright, who is the primary care operations. Thanks for coming on the show.
Thank you.
First of all, tell me a little about yourself.
I've been with Lehigh Valley since January of 2021. I am a nurse practitioner in family medicine. I did do family medicine prior to that, but just been with the network since January of 21. Do have 3 children, like you said. They're teenagers. They go to Hazelton area, so we're super busy all the time. So if you don't see me in the office, a lot of times you're catching me, my husband, and our children at some ball field somewhere, some gym somewhere in Hazelton. We're super busy all the time.
So you have the background in your, you know, I'll ask about what you do there, and a little bit about yourself, Kristin.
So I have been with Lehigh Valley Health Network for the past 18 years, and the last 8 I've been in primary care, working in family medicine. And really just Hazelton is a newer region to me in my position, so I've been with this Hazelton region for the past 5 months working with the Hazelton team.
So as program director, what is your role?
So I work with our leadership team, so our clinician leadership, our clinical leadership, and our operational leadership to really just pair the two. So we all work in lockstep, going through processes and, you know, what's in the best interest for our patients as well as the community.
What is family medicine?
So family medicine it's great because it is a specialty that really handles most disease conditions, and we have a wide range from newborn to our seniors that we care for patients. So it's different from a specialty that maybe just functions on one disease process or one organ or one thing. We focus on many ailments and many things that a patient will encounter.
So what are the services you provide?
Well, the services, I mean, we can provide a variety of services. So if you want to bring your newborn into the office, you want to have their well child checks throughout the year up through their adulthood. We also offer some women's health services. We can do annual GYN exams. We can do a wide variety. You wouldn't have to go to a specialist or a pediatrician or a gynecologist. We can offer those services as well under that umbrella of family medicine.
Okay, and what do you find the most important need is right now?
For me, I think it's meeting the patient where they're at and delivering healthcare, the healthcare that they need at the time that they need it on the platform that is best for them. So whether that's virtual, whether that's in person, walk in at ExpressCARE with late hours, it's really just what they need and meeting that need.
If I want to be a patient of your practice, tell me who's in your practice in Hazelton.
Sure, so there's myself, and like I said, I'm an advanced practice clinician, and then we have 2 other clinicians. We have Dr. Nalan Ribsheld and Dr. Mohammed El Musa. Both are docs who have been in primary care for many, many years. We all were previously at Station Circle and have now moved to Airport Beltway.
Okay. So if I want to become, first of all, I make sure you got qualified people, you've been already operating, okay? So if I want to become a patient, all right, then I say, look, I'd like to become, you're welcoming new patients, correct? Do you have the availability of looking at my charts if I was any other place and knowing anything about me, or do you have to start from scratch?
Sure, so we do use the Epic EMR system, or electronic medical record system, and it is tied in with multiple other electronic medical recording systems. So a lot of times it either talks to Epic, what we use, so it's very easy for us to get records. If for some reason I can't get your records, our staff will contact your previous office and get it over to us so that we can kind of review, see what's missing, or add to it.
What do you feel the most urgent need is in the greater Hazleton area? I mean, I don't know. I would assume it's the same in different areas as well, you know. What do you think the most urgent need is in our area?
I mean, I definitely think primary care is trying to get the need out there for preventative health medicine. So I think that's something that we really push for with operations and everything, trying to educate people on that.
Yeah, there's so many opportunities, okay, and I'm trying to know what is the best way for me to get the better health care, all right? There's so many, you know, great opportunities. I mean, you're not going to lose either way, you know, but I just need to know, like, if I want to become a patient of family medicine, I want to come to see you and the doctors, all right? What are some of the things that, you know, that you've seen so far in terms of family medicines? What is it, flu? Is it, you know, is it general health care or what?
A biggest thing in the area that we see a lot is trying to get a hold of chronic conditions for people, identifying them early. So that would be things like diabetes, high blood pressure. Those are all the things that we treat. And then also some acute things, your respiratory stuff.
That's the important thing, is because some people have that. And, you know, I'll wait. And you know, it's, you know, as my wife being an RN, you know, you address it immediately. You know, get the test, do what you have to do, and that's what you do at family medicine, correct?
It is. We'll do preventative health maintenance, and during some of that preventative health maintenance or your screening labs and so forth, we'll start identifying some chronic conditions that maybe you didn't even know that you had, which is why it's super important to get established with primary care.
How do you tell somebody that it's so important, okay, to extend their lives or whatever, that they should be coming to family medicine and should be getting yearly checkups and et cetera? What do you do to convince me?
Well, I try my best to kind of, just like Kristin said, meet you in the middle, meet you on a platform that you feel comfortable doing. So a lot of times, you know, I originally come from Center County, so, you know, we have a lot of farmers there, a lot of people there that are very stubborn. They only want to see the doctor when they're sick and so forth. But trying to get them to understand, hey, if we identify that you have a chronic condition early, we definitely can help treat it or even fix it before it becomes a long-term chronic condition. So some of the screenings that we do are just to check things, see how well your health is, and if there's anything we need to start doing now before it becomes a very large problem later on.
And I think that's critical. Don't you think so, Kristin?
Absolutely, absolutely. And preventative care is just, it's essential. It's essential. That's why we really want to partner with patients. When we establish that relationship, we want to partner with you. We want you to have healthy, great outcomes, and it really starts with that preventative care.
So as a family medicine practice, if I'm interested in becoming a patient, what should I do?
Well, if you're interested in becoming a patient, really you want to find the location that's best for you. So you can go on our website, and we have all of our locations listed. You can narrow that down to our clinicians, and many of our clinicians actually have a video on there where you can get a little, just a little insight. Why did they enter medicine and healthcare, and what's their philosophy of care, and how does that work? So that really helps us connect patients or potential patients to the clinicians. And then we have a very robust team, which we call our new patient partnership team. And they're really a specialist. They help prepare that patient coming in. So when they come into the office, they're familiar with all these terms, and they're familiar with and the expectations on that partnership and how to make it that continued lasting relationship.
It's funny you should say that, because when I'm interviewing doctors, I ask them the same questions. You know, why did they do it? The passion, because I could see, you know, you have the passion for what you're doing, and that's important. You know, that's always a the test that I take in the places I've been going to here in Hazleton. The people have been great. The doctors have been fabulous. You know, they can't do enough for you. You know, you're in a situation where you don't want to be in the first place, you know, or maybe you're not feeling good. You don't need someone yelling at you. You need comfort, don't you think? You need that bedside manner, and you guys certainly have that.
And that's the importance really is creating that relationship. You want that trusting relationship. So you're comfortable talking to that clinician about the many variables and the things that are influencing your healthcare. Are there outstanding factors or just really important influencers?
And once they come and they become familiar with you, you know, and then it's like, oh yeah, no problem, you know, they feel good, you know, get my blood pressure checked or my blood work done. Phone number, my friends, is 888-402-LVHN. And you're open what times you said before? Monday through Friday, what are the times?
We are open Monday through Friday, and they open as early as 7:30 in the morning, and they're there until the end of the day, till 5 o'clock. A few days, maybe a little bit later, not on the weekends. That's why it's great that we partner with ExpressCARE, because they're in the same location on the weekends.
Anything in closing you'd like to tell our viewers about healthcare and why they should come to family medicine?
Oh, just come and get established. Use us as a tool. Like you said, don't come thinking that we're going to yell at you or you haven't been to the doctor for 5, 6, even 10 years. You know, we're just there to help educate you, and we're there to work with you and see what you feel comfortable with moving forward.
So you're not going to scold the person and say,
No,
I haven't been to a
never.
doctor in 10 years. Well, why did you? You know, you're not going to do that.
Never.
You know? Then here's what you hear. I'm afraid what they're going to tell me. I mean, you hear that sometimes.
All the time.
You know, well, you know, I know, but maybe that's important what they're going to tell you. Well, listen, nice seeing you guys again, okay? Once again, my friends, there's a difference between ExpressCARE and family medicine. They're in the same building. Phone numbers on the screen. It's interesting. All I know is that you got the best care, health care, with Lehigh Valley Hospital in Hazleton. We'll see you next time.